For those who say that folks in healthcare have no business in politics, this is exactly why we do. I want to talk about the decision from the Vaccine Advisory Committee to pull hepatitis B out of the recommendations for newborn infants. This is a disastrous change that has been voted on just yesterday to no longer recommend that newborns in the first day of life receive their hepatitis B vaccine. Prior to our universal recommendation for infants to be vaccinated for hepatitis B, which happened in 1991, there were 18,000 children every year who were under the age of 10 years old and were diagnosed with hepatitis B. Half of those, 9,000, were taking place during the birth process. Now that number is down to 20 children a year who are diagnosed with hepatitis B and who are under the age of 10. When someone gets hepatitis B infection, they're at significantly increased risk for things like liver cancer, liver failure, death, and it's something that we can totally prevent. What's also frustrating about this whole thing is this other recommendation that they have that children are then tested for antibodies to decide whether subsequent doses are needed or not needed. Like, these are the kind of things that are decided by people who've never had to care for patients. As people who actually care for patients, as a pediatrician, it is already so difficult to be able to get a baby to come into clinic, to get their routine vaccinations. Now you're telling me that parents now need to go and get blood work done. We need to wait to receive results. And then we need to decide whether or not to give them another vaccination. Then they have to come back in for that. Like, these are decisions that are being made by people who have no idea what it's like to actually care for babies, for patients, and are making these decisions off of these radical anti-vaccine beliefs. It has nothing to do with science, and it's going to kill children. It's not an exaggeration to say it. This is absolutely a devastating blow for public health, for children, for families. RFK Jr. and the Vaccine Advisory Committee members who voted for this change should be absolutely ashamed of themselves.